we're going to present some results on from a two-center cohort. So these were two studies separately. One is still ongoing in our center. The other center is in Denmark from the Zealand University Hospital. And in both of these studies, patients with epilepsy, with frequently enough seizures, so around at least 2 seizures reported per month, were asked to monitor from home their own epilepsy, so to self-report their seizures, either on paper or on an electronic diary, while at the same time using this new device, which is ultra-long-term subcutaneous EEG. And just to briefly explain, this device, this is a minimally invasive device, so it consists of 2 parts. One is an implant, which is a 10-centimeter wire with a coin-shaped housing that houses the electronics, and all of this is placed under the skin. And with this device, it is under local anesthesia, and it's placed on one side, so unilaterally. And we place this implant according to the region where we believe the seizures are best seen on the EEG. And then patients use an external device, a logger, data logger, that connects over the skin via induction, and it starts recording. So people can record EEG for many, many weeks in quite an unobtrusive manner. And this is clearly an advantage over more invasive EEG systems, such as intercranial EEG, where the electrodes are actually placed inside the brain or at the surface of the brain. And this, of course, carries more risks to patients. So we believe that this might be a solution that applies to a wider population of patients, that will be more acceptable. And so we used data from these 2 cohorts. And then we annotated every seizure that we could find on the EEG for each of these patients. And we trained some deep learning models on these data. And we actually trained on the hour preceding the onset of the seizure, so that we could devise some kind of seizure forecasting system that could be used in real life. And then we tested this on a separate part of the recording for each of these patients. So each patient had its own set of models, so they were tailored to the specific patient. We found that quite promising results. So these are early results, but quite promising. We used 3 different types of models on these data for each patient, and we found that the forecasts were statistically significant, so they were better than a random predictor in 3 to 5 out of the 6 patients, depending on each model. And the performance results were, I would say, modest at the beginning, but they're still quite promising. So we were able to, for example, predict from 64% to 80% of the seizures in these significant forecasts, while at the same time holding the time in warning. So this would be a time where the forecast will be in a high warning state, as low as possible. And this was at the range of 10% of the whole day, up to 44%, depending on the patient and on each model. So again, quite promising results, still early phase. We're not sure how this will translate clinically in the future, but this is clearly a good start.